Thank you for attending my e-poster on pediatric airway education. My name is Cheryl Yang, and I am a pediatric emergency medicine fellow at Primary Children's Hospital. I performed this study with Dr. Megan Fix, Dr. Sarah Becker, and Dr. Zachary Drapkin. A little bit of background on the study. Pediatric intubations are critical procedures that can have significant morbidity or even mortality. Due to its complexity and low frequency, it is challenging for trainees to attain procedural competency. In traditional intubation training, trainees practice intubation on a mannequin while instructor provides feedback. Use of video laryngoscopy, or VL, device with the camera at the end of the blade that allows others to have identical views of the airway as the operator, in training can improve acquisition of intubation skills. VL also facilitates the ability of an observer to coach the operator through the procedure, which was shown to increase neonatal intubation success rates. Integration of coaching using VL for pediatric intubation training has not been well studied. The objective of our study is to determine if coaching via video laryngoscopy is superior to traditional method of training for learning pediatric intubation skills. For this study, we had participation from 23 emergency medicine residents and 9 medical students at the University of Utah. All learners received a didactic session on pediatric airway management. Learners were then randomized into an intervention and control group to practice intubating on an airway mannequin. The control group practiced using hands-on time with traditional direct laryngoscopy under the supervision of a facilitator. The intervention group used VL coaching to practice intubation techniques. During this process, the learner watched the facilitator attempt to intubate a mannequin and then had to coach the facilitator through challenging portions of the procedure. Our primary outcome was the ability to achieve first pass success on a difficult airway mannequin after the teaching session. Secondary outcomes were learners' knowledge and confidence with pediatric intubations via pre- and post-curriculum surveys. Our data analysis showed overall improvement in average scores related to pediatric intubation knowledge questions pre-curriculum and post-curriculum in both control and intervention groups. No difference between the control and intervention groups with regards to the level of training, prior intubation experience, pre or post-intervention confidence, pre or post-intervention survey scores, or first pass success. Subjective feedback from the session was overwhelmingly positive. For example, one participant said, "By making us coach through the practice portion, it forced us to think through the process and troubleshoot." In conclusion, an innovative method of pediatric intubation education was successfully implemented. While limited by small sample size, our results show improvement in all learners' knowledge and confidence pre- and post-curriculum, regardless of whether practice came primarily via hands-on practice under facilitator supervision or by coaching a facilitator through the procedure. No difference was observed on first pass success on a difficult pediatric airway mannequin between the two groups. Future directions include larger sample size and modification to the coaching process.